You're listening to America's Web Radio and the AmericasBroadcastNetwork.com. Thank you for listening.
Well, good morning, everybody. Joe Gavalis here with the Safe Senior Hour. I hope you all are safe and healthy and doing well. We're very honored today. We have Melanie McNeil, who is the National President of the National Association of State Long-Term Care Ombudsman Programs. Good morning, Melanie, and welcome.
Hi, Joe. Good morning.
We thank you for being on. Melanie is also the state of Georgia's state long-term ombudsman and has been a guest on our show for, I guess, several times. But what's significant is it's a little different time out there now than we had it when we were just talking about regular issues. Now we have this coronavirus that is affecting everybody. So I know it certainly impacts your programs nationwide and what each of your corresponding state directors or state, however their title is in each state. I think it's different. So thank you for coming on and helping to let America know and our listeners and the world of what you're doing and what you can do. So if you could just go through it first, just give us a little idea about the National Association. What does it encompass here?
Sure. Okay. So the National Association of State Long-Term Care Ombudsman Programs is an association of the state long-term care ombudsmen from across the country, the District of Columbia, Puerto Rico, and Guam. So in all of the states and the District of Columbia and those so Puerto Rico and Guam, have long-term care facilities of one type or another. And it's federal law that has authorized long-term care ombudsmen to be advocates for residents of long-term care facilities. So NASOP, our national association, is an opportunity. We meet regularly over the phone by conference call to share experiences, to share strategies, stories about just situations. And so it's helpful, especially during this time of COVID-19, that we share with each other how we might be helping residents to raise concerns even though we're not physically in the buildings, how we might help families connect with their loved ones, how we might work with facilities to get information out to the residents and the families. And so our organization is there to help us all be better state ombudsmen to then help the consumers in our state, our long-term care residents and their families, have the best experience that they can. So I just wanted to let folks know, if you're trying to locate your ombudsman in your state, you can go to our website. So it's nasop.org. So that's NASOP.org. And you can click on the landing page. There's a big spot where you can click on Locate an Ombudsman. So if you're listening in California or you're listening in Kentucky or Ohio or Idaho, wherever you are, you can go to our website, click on that link, and it will take you to the Ombudsman program for your state.
If I can, I was looking at your website and I read saw you have a comment what your mission is, and it's very significant for what we're going to be talking about today. That it says, our mission, as mandated by the Older Americans Act, the mission of the Long-Term Care Ombudsman Program is to seek resolution of problems and advocate for the rights of residents of long-term care facilities with the goal of enhancing the quality of life and care of the residents. That's said kind of succinctly. So let's just kind of break this down and let people know in the way it was before COVID-19, what you all would do and how that has changed with this COVID. If you could kind of go through, your mission here, that you were started by the federal government. Older Americans Act is a federal act, correct?
Right. So, and as you probably know, Joe, and maybe your listeners know too, the Older Americans Act was just reauthorized by Congress, so that gives us another, I think it's 5 years of authority. It renews every so often, or is reauthorized every so often. But our basic work is normally we would be visiting in long-term care facilities, and most of us visit at least quarterly, some more often. In a few states, they may not visit every quarter, but generally speaking, ombudsman representatives are visiting at facilities as a part of their normal work. So probably every week, our ombudsman representatives are out in the field, going to facilities, observing the facility itself. Does it smell clean? Does it look clean? Are are things working, as they should? We visit with individual residents in their rooms to explain to them that we're advocates for the residents. We don't work for the facility. We work for the residents, and we're advocates for them. We talk to them about their experience there in the facility. And frequently, a resident won't have an issue or concern. They'll just talk to us about, how their services are being provided and how their life is in the nursing home. But sometimes, or assisted living or personal care homes, boarding care homes, the long-term care residents will tell us sometimes that they have a problem. It could be something that's fairly easily fixed, or it could be something that will take some time and creative thinking to fix that particular issue.
Melanie, excuse me, if I could interject, just for our listeners, we're using the term long-term care facilities. Can you just give the listeners just the everyday language of what are these type facilities? Because
sure, Joe. Gosh, I apologize.
No, that's fine.
Yeah. So in the Older Americans Act, it gives us authority to enter nursing homes and what are described as board and care homes. And so for most people across the country, you've probably heard that term assisted living. And what that means is it's a place you go and you might have some help with bathing and getting dressed, some, sort of normal kinds of everyday activities that are just a little harder for you, maybe because you have arthritis or you have some other disabilities. Usually it involves some assistance with taking medication. Usually food is provided, so you have a dining experience as well. Some states call those adult homes or adult foster homes. Here in Georgia, we call them personal care homes, or sometimes assisted living. It depends on how their life is. But essentially, it's the kind of care that doesn't really require a lot of medical supervision, as opposed to nursing homes, in which case those residents need more medical interventions or medical assistance. And so I think maybe defining it that way will help everyone, regardless of where you are in the country. Nursing homes are more medical. Assisted living, board and care, personal care homes are less medical.
And usually less people, right? Isn't that the way? It could be smaller number of residents.
Sorry?
I would say smaller number of residents. Correct.
Frequently.
Yeah.
Yeah, frequently assisted living or personal care homes are smaller, although I think probably everybody has seen those really big assisted livings that might have, the really fancy and nice 100-bed facilities. Many of those board and care homes or personal care homes are much smaller, and assisted living, even some of those are a good bit smaller.
So before I just wanted to clarify that. Let's go back. So you all, by federal statute, have the ability, you're the advocate, as your mission says, for the residents of all these care homes, and that gives you access to talk to the residents about their quality of life and their care. And before the normal way, you would make visits, correct?
Before COVID, yes.
Yes.
We would visit all those types of facilities and talk with residents. Yes, just what you were saying, Joe, about the quality of life and the quality of care, and any concerns they have. If they will give us permission, we will then try to address them. We'll usually talk with residents about ways that they might be able to advocate for themselves. And sometimes residents will say, you know what, I'm just going to I'll take care of it.
Right.
But sometimes residents want some assistance, or they might not even want to be identified. They want the problem fixed, but they don't want it particularly related back to them. And we do the best we can to keep their complaint, to address a complaint, but keep them anonymous when it's possible to do that. We also work with families because often they'll be the one who calls with a concern. Again, for us, we have to go back and visit with the resident first to be sure that the resident wants us to take some action, if they can tell us. And we need the resident permission to do that. But especially during this time of COVID-19, we might be getting calls from family members about care concerns they have for the resident because the family isn't able to visit right now, or they can't visit in person anyway. And they may feel that, the families, may feel that they are not being heard, and so they may call the Ombudsman program to say, can you help us work with the facility to resolve whatever the situation might be. So ordinarily, before COVID-19, we would go into the facility and talk with the resident about the concerns the family has raised, and then we'd go talk with the appropriate staff. If it's a laundry issue, of course, we'd talk to housekeeping. If it's a food issue, we'd talk to dietary. If it's a care issue, we might talk to the director of nursing. So now we do that by phone because the Ombudsman representatives don't go into the buildings either right now unless it's a very dire situation. So I want people to know, I want the listeners to know that you can still call your Ombudsman representative. Even though we're not going into the building, we can still advocate for you. We might know strategies, or we may know different approaches that would help as residents and families are trying to resolve whatever their situation may be. So, again, if you go to the NASOP website, so nasop.org, and click on Locate an Ombudsman, anyone across the country can then find their Ombudsman representative.
And I think what's important that you or your representatives, and we'll go into that in our next segment about how you all are staffed and how you interact. But things before COVID-19 came on is that families were constantly encouraged to come and visit their loved ones in these nursing homes or long-term care, and you all would be in there. And I think that's the significance of what we're going to discuss in more detail here after the break. So we're about to take our first break on the Safe Senior Hour, and we'll be back.
Want to give your family or loved one the perfect gift? Then go online and check out the TornadoBodyDryer.com. I love mine and the warm heat air massage it gives me after my shower. The Tornado Body Dryer is super. You'll love it, and you'll love having one in your shower.
Whether cruising the strip in a 57 Chevy or taking the family on a vacation in a 71 Oldsmobile Vista Cruiser, you need to tune in to Classic Cars with Steve Ronaldo and Jim Weber every Saturday from 8 to 9 a.m. on americaswebradio.com.
This is Dr. Susan Blank, host of Detailing Addiction and medical director of the Atlanta Healing Center. Please join me on Tuesday afternoons at 4 p.m.
You're listening to America's Web Radio on the AmericasBroadcastNetwork.com. Thank you for listening.
Well, welcome back to the second segment of the Safe Senior Hour with Joe Gavalis, and we're very fortunate and honored to have a guest, Melanie McNeil, who's the national president of the National Association of State Long-Term Care Ombudsman Programs, and she's also the State of Georgia director, and been a guest on our show before. And again, thank you again, Melanie, for coming on, and especially in this time of interest of everybody concerned about their loved ones. So thank you.
Thanks, Joe.
We were talking before the break. We were going through about what little background of what the Ombudsman's program does, and your mission statement is really clear, is the enhancing the quality of life and care of residents of long-term care facilities. We discussed what they were. They were nursing homes, things that were maybe called assisted living or personal care homes. And you are the like the go-between, what I got, between the resident and the facility, and we get a lot of information from the families, correct?
Yes, we often get information from families about situations at the nursing home or the assisted living or the personal care home.
Right. And a lot of this would be because the resident would be telling their loved ones if you can give us some examples, like I think you talked about a laundry issue or stuff. Could you just let the listeners know things that the Ombudsman might be able to help from actual not cases, but matters that you've heard already being discussed with your fellow ombudsmen?
Well, so generally, we might get a call from a family member that says their loved one's clothing has gone missing, for example. That's a laundry situation.
Mm-hmm.
Sometimes it's more about care. So a family member might call and say, my loved one, when I went to see them, they were not up and dressed, and it was the middle of the day, or it seemed like maybe they hadn't had a bath in a while, or they're aware that their loved one has a wound of some kind, and they feel like that's not being addressed. We would then go and talk with the resident first, if the resident can tell us what the situation is. And the resident may say, I know my laundry has gone missing, but I don't want you to do anything about it right now. I've already talked with the housekeeping people, and they're looking into it. They might tell us that. Or they might say, you're right, my clothing has gone missing. I haven't had my favorite sweater in a couple of weeks. And so then we would talk with the resident about trying to address that with housekeeping. It can be, like I mentioned, it could be a dietary issue. So a resident may be getting food that they shouldn't be getting. For example, if they're not supposed to have, let me just use this as an example. They can't swallow very well, and so they're not supposed to get the meatloaf like everyone else does. They have to have it pureed, or they have to have it prepared in a different way. Again, we would go and talk with the resident about it first and make sure that it's okay with them to advocate for it.
So it is for our listeners out there. It is, you all are first of all very dedicated to what you do, and we can't thank you all enough. But it's a voice it's a place where they'll listen to the voice of the families if there are concerns, and then try to work it out if the resident agrees. Is that basically it? Yes.
Sometimes residents don't want us to do anything because they fear retaliation, or they just may not want to raise the issue. They have their own reason that they don't want to raise the issue. So that's why we need their permission first. And then from there, if the resident won't give us permission, we would talk with other residents to see if they were having similar concerns, and if they would give us permission then to take some action. But sometimes the families want us to do something and the resident just doesn't want anything done about it, and we have to go by what the resident wants.
Right, and again, but unless somebody is listening to the issues that the families or the loved ones, not necessarily the part of the family, but people who are caring. I know we have a lot of friends that are in nursing homes, and it's it's former neighbors that are very concerned because the family is in another state or something. And so that information, and I can see why, because they would look at what they think is important, but the resident doesn't want to raise the issue. And that's why you go to the residents, correct?
Right. That's why we talk to the resident first. And thank you for mentioning, Joe, that sometimes family members are out of state. We often get calls from family members who live in other states, but their loved one lives in a facility here in Georgia. And that's true across the country. So if you're a listener in Pennsylvania, but you have a loved one in Texas, you can call the Texas Ombudsman and tell them your concern on behalf of the resident that's there in Texas. And the Ombudsman there will work with the family member in Pennsylvania to go and talk to the resident, find out what the situation is, and try to resolve it as long as we have permission from the resident to do that.
And I think that's really significant. I mean, it gives people a place to go when you're many, many miles away to address an issue without having to go and I've talked to people before. Well, we thought we had to hire an attorney. We thought nobody would listen to them, and we'd say, well, have you tried the Ombudsman's program? And they go, well, what is it? And you tell them, and they would get back and say, well, thank you for telling us that we got it resolved, and it was to everybody's satisfaction, and everybody's happy, and they were honest. They said it saved us a lot of money because. And it was worked on relatively quickly. It wasn't like, oh, we'll get to you in 6 months or a year. People try to address it. I don't know if you have a kind of a guidance for time to handle complaints or not, do you?
We do. I think most programs do. I can't say for sure that they all do, but I suspect they all do. We have a standard of promptness so that, if it's a very serious situation, we're probably going to try and address it that very day if we can. But if it's like missing laundry, for example, we do prioritize the work that we're doing, and so but even something that seems somewhat benign like missing laundry, we still have a standard of promptness that it must be addressed within 7 days. That's our standard in Georgia. I don't know what it is in each of the other states, but I'm sure they have similar standards of promptness to at least find out what the issue is, try and reach the resident. Some issues resolve fairly quickly, and some issues do take some time. So if it involves talking with the doctor about making a change to the resident's care plan or an additional type of service that the resident wants, sometimes it takes time to get all those things set up, if it's possible to do that. So not everything resolves that quickly, but anyone who has a complaint for an ombudsman program should hear back fairly quickly from the ombudsman representative about what the concern is and how we'll move forward to try and resolve the problem. So they don't just languish.
Right. And I think that's your point, that every state has an ombudsman program, and I guess territories. I guess didn't you say Guam has it? And
right.
Yeah. Could you just go over just generally to let our listeners know how and I know it's different in every state, but who are these ombudsman's representatives? Is this how is it done in the various states?
Well, every state has to certify their ombudsman representatives. Each state does it a little bit differently. Frequently, our ombudsman representatives are individuals who have a social work background, but that's not always the case. Sometimes our ombudsman representatives have worked in a nursing home or an assisted living in the past, and they've decided to make a change and want to be an advocate for residents. So we have, here in Georgia, we have folks who have been administrators of long-term care facilities, activities directors, other types of individuals who work in long-term care facilities who decide they'd really like to be an advocate instead. But generally speaking, our ombudsman representatives are not usually nurses, for example, although we have some nurses. I imagine most programs have at least a few nurses, but most have some type of a social work background or a social services background of one type or another. And so people who are very concerned with identifying what the problems are and then doing problem solving. I think that's the most important skill we ask of our ombudsman representatives, to identify problems and then be creative in ways to try and resolve them to the satisfaction of the residents in particular and their families and facilities when when we can.
Right. Is there pretty much a standard? Are these people paid state employees? Are they volunteers? Or how does that work? And I'm sure that there's
Well, that's a good
might be
question, Joe.
different.
In some states, ombudsman representatives are state employees. In some states, the ombudsman representative work for a nonprofit agency, or they might work for the area agency on aging. Some states use a lot of volunteers who make regular visits to facilities, and some states use some volunteers. So some programs are very volunteer-driven. I think Florida is a state that uses a lot of volunteers. Some states use some volunteers, like we do here in Georgia. We use some volunteers, but we have more paid ombudsman representatives than we have volunteers.
Okay, and if I'm a listener out there, and especially now when people are looking to whatever they can do to help, is there, and they have an interest to either volunteer or try to apply if there are openings, what is the best way to do that?
Well, probably, I can say for Georgia, but I imagine for the other states as well. You can reach out to the state long-term care ombudsman. Every state has a state long-term care ombudsman, so you can reach out to their office and indicate your interest, whether it's as an employed ombudsman representative or as a volunteer, and then the state office will help you connect with whatever feature of the program would work for you. So like here in Georgia, we've divided the state up into 6 segments. I think other states have done similar things. You know, they divide the state up into different areas.
Right.
So if you live in a particular area, you probably want to volunteer in that area. So your state ombudsman would help you connect with that particular area to apply for an opening, apply for a job if there's an opening, or if not, to volunteer, and they'll help with that.
And is there a somebody comes in with either a nursing background or working in a one of the long-term care facilities that might be retired, that's looking to help out any way they can? Is there a training program? Is there a test, or basically through interviewing and looking at their background? And I know you can't speak for every state, but pretty much, how is that done?
Well, yes, every state does have a training process for certifying their ombudsman representatives and for deploying volunteers. In fact, through the Administration for Community Living, we have some guidance now about training. I think most states probably covered the type of training that we've gotten from the Administration for Community Living, but now we have a little bit more formal guidance about recommendations for how to do the training. Some states are very rigorous, and Georgia is a very rigorous training. In some states, it's not quite as intense. So for us in Georgia, for example, you have 3 days of classroom training. You have 3 days of training in 2 days of training in a nursing home, a day of training in assisted living, field work, and a written exam and an oral exam. So it's just pretty rigorous. In some states, they may not have quite that same amount of training. Part of what we do in Georgia is prescribed by state law, and each state probably has similar kind of guidance in their state law about the training that's required. But again, we have got some training standards from the Administration for Community Living, and so people don't need to feel like they're going to get just sort of pushed out there. They will have sufficient training so that they'll be comfortable.
Well, I do appreciate that. We're going to have to take a break from our second segment, but we'll be back with Melanie McNeil, the president of the National Association of Long-Term Ombudsmen, right after this break.
Okay, quickly I want to mention the fact that Department of Justice, DOJ, has contacted us and asked us, and also Fox News picked up on this, that right now the scams are going crazy, calling elderly and saying, look, if you just give me your Social Security number, I can assure you that the payment will come faster from the government, or on and on and on, or we've got the cure for COVID-19 virus or coronavirus, or we can do this, any way to get $1 out of your pocket or your loved one's pocket. So if you're elderly, you get a phone call, you get an email from somebody that you're very curious about asking you for money because they can do something with the government. One, cancel them or delete them or hang up on them, and if they call back, call the police. These people are terrible, and we want to put a stop to it, and you can put a stop to it by hanging up on them. So with that being said, we'll get back to the show momentarily.
If your health insurance premium is more than your mortgage, Ellen Deal with Ideal Solutions is here to help. Whether you're a small business owner, individual, family, or baby boomer, email MAGA45CAG@gmail.com and I'll respond with 3 easy questions to help you determine if you can get away from Obamacare. As a 20-year veteran of the insurance industry, I'm here to help with all your insurance needs. Email Ellen Deal at MAGA45CAG@gmail.com.
The disease of addiction is a life-altering challenge, not just for the person suffering its effects, but also for the family and friends who support and love the one caught in its grasp. What should be the course of treatment? Who is the best person to render treatment? And what is the best place to go for the care that is needed? We know that you want answers to these and many more questions. Call 770-696-9862 and speak to a representative of the Atlanta Healing Center. They can tailor programs specifically designed to address the needs of the person suffering with an addiction, or give you guidance as to where that help may be found. Information is the key, and the trained staff at AHC is here to assist. If you wish, you can also get more information on the website located at www.atlantahealingcenter.com.
You're listening to America's Web Radio on the AmericasBroadcastNetwork.com. Thank you for listening.
Well, welcome back to the third segment of the Safe Senior Hour with Joe Gavalis, and we are honored to have a guest today, Melanie McNeil, the national president of the National Association of State Long-Term Care Ombudsman's Program and the state ombudsman for the state of Georgia. Before we go in, I'm just going to follow up on what David said. The North Georgia Elder Abuse Task Force here, in cooperation with the Northern District of Georgia U.S. Attorney's Office, has put out a notice about the to avoid coronavirus scams, and just some tips that we all should be aware of. Hang up on robocalls, and that scammers are using illegal robocalls to pitch everything from scam, coronavirus treatments to work-at-home schemes. 2, verify information. Contact trusted sources to confirm information is correct. For the most up-to-date information about the coronavirus, visit the CDC at www.cdc.gov. The third item is know who you're buying from. Online sellers may claim to have in-demand products like cleaning, household, and health and medical suppliers when in fact they don't. 4, don't click on links from sources you don't know. Very important. Once you do that, you're just it's like opening your door and inviting people into your house. That's what you do when you just click on a link for somebody you don't know on the computer. And do your homework. Don't let anyone rush you into making a decision or making a donation. If someone wants a donation in cash by gift card or by wiring money, don't do it. Those are the quick list of things to be aware of. And if you believe you're a victim of a scam, call your local police or sheriffs and then file a complaint with the National Center for Disaster Fraud. Its initials are NCDF, but it's a 1-866 number, and it's 1-866-720-5721. And that, just call that number and advise them that you've been a victim of a scam, and they'll advise you to what to do or where to go. And then, of course, there's other government agencies that you can deal with and their websites. But this is very important. You have that number 1-666-720-5721. So with that, we'll go back with our guest, Melanie. And Melanie, we were talking about, I think, the training and mandated training for volunteers or your employees that you have in Georgia. And I think you're talking about 3 days and then other deals. Could you just go over that real quickly so we can cover that in a little more detail?
Sure. So, Joe, again, across the country, each state has a program of training both for their employees, their paid staff, and for their volunteers.
Right.
Yeah. And so for staff ombudsman in Georgia, for example, they have 3 days of classroom training. They have 2 days of training in a nursing home, 2 days all day long in a nursing home, a day in assisted living, board and care homes, however you want to describe them. And they have field observations and field work, and then they have a written exam and an oral exam. I don't know that all states have that many steps. Ours is directed to some degree by our state law, but the Federal Administration for Community Living has also provided some guidance for training for both staff and volunteers. Part of the reason for the training is to make sure that our staff ombudsman and our volunteers are comfortable with what they may encounter, what kinds of issues they might encounter, how to talk to residents, and how to really be sure you're listening to what the concerns are, how to then develop some strategies, get permission from the resident to take action, and how then also to deal with facilities to get to the place that the resident is satisfied with whatever the resolution may be. So all of that training for both staff and volunteers is so that they can do the best job they can to help residents and families feel like their loved one is getting the best possible care and the best quality of life that we can, so we're going to advocate for that.
And just to remind our listeners, the Ombudsman program is open for business throughout the United States.
It is. So, as we were talking before, Joe, typically we would be visiting in facilities. And I should say that under ordinary circumstances, in the wintertime, most every state is experiencing flu in long-term care facilities. So some of the guidance we've been getting recently about COVID is guidance we would use even in a normal time. Wash your hands, don't touch your face, don't touch surfaces, so that we're not taking any kind of flu or anything. So that we're doing as best we can not to take it from room to room or from one nursing home to another nursing home. So we have those kinds of guidance and practices, I guess I should say, typically. But with this COVID virus, because it acts a little bit differently, everyone is being more careful because the experience, especially of people who have underlying conditions or who are older, are more susceptible to the worst outcomes. So we're trying to be extra careful. So ordinarily this time of year we would be visiting in facilities, but right now we aren't actually going in, except in extraordinary circumstances where it just seems that we absolutely have to be there. And of course we would be working with the facility about a safe way to be in the facility. We do the screening. I think part of the reason that all the facilities are being especially careful right now is there is a lack of personal protective equipment. So we don't have the masks and the gowns and the shoe covers, all those things that we might ordinarily use if we were going to a room where a resident is particularly has a particularly virulent or contagious kind of a situation. So that's, I think, part of the reason that even for families, the facilities just don't have the protective equipment to help keep the visitor safe and the residents safe and the staff safe. I'm sure that's part of the reason.
Right.
But nonetheless, what you were saying, Joe, is we are still open for business. So everybody's trying to be creative. Facilities are trying to help their residents use FaceTime or or another way to communicate with their loved ones. What I've heard from our folks in the field is that families are coming to the window of the resident's room, and they can at least see their loved one, and the loved one can see the family through the window, and they may talk on the phone. For those families who are farther away, they might do something like FaceTime. Not every facility has that ability. Not every resident will be able to take advantage of that, but many more of them are doing that now than we might have in the past, just, to keep everybody safe and to make sure that we're not spreading it, inadvertently, that we're not spreading the virus even farther.
Melanie, could you give that number again that you gave earlier, that if people are wondering, who do I get in touch with or where, and especially the example you gave, somebody lives in the Midwest and their loved one is in a nursing facility in the Southwest or in Southeast, who to call and to get some help.
Right. So if your listeners will go to, it's the NASOP website. So it's N like Nancy, A like Apple, S like Sam, O like Oscar, P like Paul, NASOP.org. When you open that page, you'll see in the right-hand corner a big square that says Locate Your Ombudsman, or Locate Ombudsman. You just click on that. It will take you then to a website that shows all the states, and you just click on your state, and it will take you to the state ombudsman. So, and then you can make, further connections from there to the person who might be the one that would ordinarily be visiting with your loved one in a facility.
So just to make clear, let's hypothetically say I'm in Wisconsin, and my loved one is in a facility in Arkansas. So what is your recommendation for me as a family member who has a concern? Should I call my Wisconsin ombudsman and have them, or would they then call Arkansas? Or can I call Arkansas directly? What is the protocol there?
You can do any of those things. So I'm sorry, I didn't even say that at first. If you live in Georgia, but you're concerned about a loved one in Montana, you can call me in Georgia. You can call the state office in Georgia, and we'll help you connect with folks in Montana. All the state ombudsmen would do that. So if you live in Ohio, you call the Ohio ombudsman. But you can also go to the NASOP website, so
right.
NASOP.org, and just click on the link, and it will take you to, so if you live in Wisconsin and you're trying to get to Arkansas, you click on Arkansas, it will give you the contact information for the Arkansas State Ombudsman. And that Arkansas State Ombudsman will help, anybody who calls, that's what we're there for, to help make a connection with an ombudsman representative who is in the field, who would be visiting, your loved one's facility regularly, and then they can make the, contact from there. So either way, call your state ombudsman or click on the link to the state where your loved one lives and call that state ombudsman.
We failed at the beginning to go through, what is your background, so people know what your background is, Melanie?
Oh, well, so, Joe, I actually have a law degree. Some state ombudsmen are lawyers, but we're not. So we're state ombudsmen. But I was an older advocate for about 11 years before I became the state ombudsman. I've been the state ombudsman now for 10 years in August. So I have a strong advocacy background, and that's what our program is all about, advocacy for the resident, trying to do what it is that the resident wants. And we're there to advocate with the facility staff or with others in order to make sure that the resident has the best quality of life and care that can be possible for them. So our program is all about advocacy and whatever we can do to help the resident.
And go ahead, I'm sorry.
And I just should also say, Joe, that our services are free, so you don't have to pay for an ombudsman representative to help your loved one. You were talking in an earlier segment about hiring an attorney. Sometimes that may be appropriate, depending on whatever the concern is, but before you go there, you can always talk to the ombudsman representative first, and if we can assist, we'll do what we can to make things.
Well, our listeners, anytime you get something for free that you're dealing with from an entity, from a governmental entity, please take advantage of it. We should do that. But we're going to come back here. That'll end our third segment of the Safe Senior Hour, and we will be back and go into some more issues with dealing with COVID-19 and with Melanie McNeil.
The disease of addiction is a life-altering challenge, not just for the person suffering its effects, but also for the family and friends who support and love the one caught in its grasp. What should be the course of treatment? Who is the best person to render treatment? And what is the best place to go for the care that is needed? We know that you want answers to these and many more questions. Call 770-696-9862 and speak to a representative of the Atlanta Healing Center. They can tailor a program specifically designed to address the needs of the person suffering with an addiction, or give you guidance as to where that help may be found. Information is the key, and the trained staff at AHC is here to assist. If you wish, you can also get more information on the website located at www.atlantahealingcenter.com.
Hello, I'm Dr. Mike Karuchak. Have you ever wondered what doctors talk about amongst themselves? If you do, join us on the Doctor's Lounge and hear the doctors' conversations amongst themselves. Join me and my co-host, Dr. Hal Schertz, every Thursday morning, 8 to 9 a.m.
Get your pen and paper ready. If there's a move in your near future, I'm here to tell you that the folks I used and now recommend is Around Town Movers. Timothy and the guys recently moved me, and I am and was totally satisfied with a sometimes not so fun experience moving. Call Timothy at 770-378-4708 and make it a good move and a good experience. Around Town Movers for that local or cross-country move. Timothy, Around Town Movers, in my opinion, are the best. That's Around Town Movers. Call them.
You're listening to America's Web Radio on the AmericasBroadcastNetwork.com. Thank you for listening.
Well, welcome back to the final segment of the Safe Senior Hour with Joe Gavalis. And again, we're honored to have a guest, Melanie McNeil, the National President of the National Association of State Long-Term Care Ombudsman Programs. There's an ombudsman program in every state. And she is also the state of Georgia, the state long-term ombudsman, and we certainly welcome her back. And just before we go into our last segment, talking about some specific issues dealing with the new rules dealing with COVID-19 and how we have to dealing with loved ones in various long-term care places. I just want to go over and let people know that just some issues that have taken place, concerning the scams dealing with the coronavirus scams. Just some highlights. The Department of Justice sues and shuts down a website claiming to be selling a virus vaccine and just taking people's money. In Australia, as you know, this is a web radio, and this goes all over, not just the country, but all over the world. And the Australia warns of virus scams. They put out a notice. The FBI put out a notice. The United Kingdom warns of scams that they are seeing. The Missouri, here in the United States, Attorney General sues an evangelist over claims for virus treatment products. Remember what we were just talking about before. We read out some tips to help you. Scammers sending email threatening to expose your family to virus unless you pay them $4,000 with Bitcoin. This is another issue. The European Union documents say Russians have launched a campaign to try and create panic in Europe over the virus. Canada seeing a fake letter to apartment building tenants asking for fees for cleaning concerning the virus. Singapore shuts down over 1,000 websites for products claiming they can help with the virus. And Interpol makes major effort to tackle the counterfeit mask and drugs for the virus. These all can be found on, and if people have an interest in these various frauds and frauds in general, the Baker Fraud Report is a great place to look on. It's just Google it and you can go online, and it gives you a pretty good rundown of different types of frauds, not only here in the United States, but all over the country. As you just heard, I just read some of those. So everybody be on the lookout and let you know, and the government can only do enough stuff if you tell them. Again, elder abuse, financial frauds don't report themselves. So you have to report it to the proper authorities, and we said earlier, call our local police or sheriff and then report it to the National Center for Disaster Fraud, 1-866-720-5721, and then that'll get you to the proper place. But now we're going to go back with Melanie McNeil, and Melanie, you and I saw an article that was in Saturday's Wall Street Journal, and it's entitled "Nursing Home Visitor Ban Raises Difficult Questions." And you and I kind of chatted about this. Can you go over the scenarios, what took place? This was an article by, I hope I'm pronouncing it right, Yuka Hayashi, Hayasshi, first name Yuka, Y-U-K-A. And it's a very interesting article concerning situations in Kentucky and in Rhode Island. And we're not going to get into the individual merits of each one, but it shows you some issues that will affect many people throughout the United States concerning with the new way we have to handle our lives dealing with our loved ones in long-term care.
Right. So for your listeners, some of the concerns that family members may have is, my loved one is quite elderly. I usually go to feed my loved one to help with the dining experience, and now I'm being restricted. For some families, the situation is serious enough that a facility may say, yes, you as a family member may come in under, these conditions. You have to be screened. You have to be very limited where you go. In some extreme cases, and we've heard about these in Georgia, a family member will refuse to eat. The resident will refuse to eat, really, really refuse. And so then the facility may make an exception. Not all facilities will do that. Not all situations are quite that dire. When someone is on hospice, and if the hospice provider says there's not much time left, then the family will want to call the facility to say, we really want to come in and see our loved one. And some facilities will make that exception. It is allowable from the guidance from the Centers for Medicare and Medicaid Services to facilities that they should keep visitors out except for these, kind of extreme circumstances.
And let me just interject, if I can. You made a very good point there, Melanie. People have to remember, the U.S. government barred family members from visiting relatives in nursing home, but it did make an exception, and one of them is end-of-life situations, and that poses a debate. But this is done from the federal government. This wasn't done everybody individually doing it on their own. That sounds, according to the article, correct?
Right. This was guidance from the federal government. So for those facilities that aren't nursing homes and may not be subject to the federal guidance, they're still going by that federal guidance because it's just like, the CDC tells us, do these things, be careful. That's what the Centers for Medicare and Medicaid Services have done, is they're telling facilities to be particularly careful. And so their state-level assisted livings and personal care homes are following suit for the same reasons, just to protect the residents and the community to protect everyone as best they can.
Well, I think that before I go on, they quote something which I think is significant for our listeners and worldwide, that we have 1.4 million elderly and disabled adults living in more than 15,000 nursing homes, according to the U.S. government data. That's a lot of people, so when we're talking about it, it could affect many people here.
Right. And, when you think about here in Georgia, for example, for all of our long-term care facilities, personal care homes, assisted living, nursing homes, it's about 80,000 people. That's a lot.
Right. Yeah.
And in each state, depending on the population, there's probably a similar percentage. And so, we want to be as careful and protective of everyone as we can. But the federal guidance does allow for sort of a case-by-case consideration. So some families have been successful in making their argument to the facility to allow them to, come to the facility. But some families are opting to take their loved ones home. And you can do that too. If a resident is willing to go home, the family members may want to do that to provide the care, like the Wall Street Journal article mentioned. The family was willing to be there around the clock for their loved one at home. I believe this is true across the country. I know it is here in Georgia that we have had some families that have just opted to take their loved one home. But not everybody can do that.
No, and I think what it does is allow people to make some individual decisions in cooperation with the long-term care, and I think in the middle of this, as my recommendation, is that you contact, if you have some issues, is contact your local ombudsman in your state and just discuss it, right? I mean, they're up for not just complaints, but to discuss some of these issues, correct?
Absolutely, right. So we are, ombudsman representatives across the country are working with facilities and families, both, because we're all in this together, with the residents too, to try and make sure the resident still has a good quality of life and yet is safe, and the family members are able to participate, but they're safe and their loved one is safe. Facilities are looking for, some ideas too to help. What can we do to make sure we have enough activities? So facilities are being creative about.
But I just got to. We're about to run out of time, Melanie, and hopefully we'll have you back on. I can't thank you enough, and have your listeners call your ombudsman and help. And again, thank you, Melanie, and that'll be our final segment today. That'll end it. And remember, elder abuse doesn't report itself. And again, I hope you all stay safe and healthy.
Perhaps you are struggling to cope with the disease of addiction. If not, you probably know a family member or friend that needs help in battling the cravings and the personal and professional damage done by the effects of drugs or alcohol. Get a pen and paper and be ready to